Good day. This presentation is one in a series of lectures on evidence-based practice in nursing. Findings from research in nursing practice have led to several changes in the way nurses deliver care. In this series, we will explore practices that have been deemed to be obsolete in view of new scientific evidence and data. We will also explore what the current thoughts are and what procedures have changed as a result of these evidence. This is part 3 of the Evidence-Based Practice in Nursing series presented by Dr. Tom Badaev. The question posed is, what is the accepted practice to confirm proper nasogastric tube placement? This segment explores the evidence pertaining to the procedure of nasogastric tube placement. The old procedure to check was to instill air through the tube while auscultating the right upper quadrant of the abdomen. Does this auscultatory finding suffice as guarantee that the tube is in the stomach? This is the question that is the focus of this segment in the Evidence-Based Practice series. Auscultation of the gurgling sound when air is injected through the tube has traditionally been an accepted objective data to confirm proper placement of an NG tube. This procedure has been found to be imperfect to confirm NG tube placement. Pseudo-gargling has led to many instances of adverse events, so much so that the Health Patient Safety Organization in 2012 issued a call for immediate discontinuation of the procedure. Other methods that have been used to determine proper placement of an NG tube includes the use of colorimetric devices such as pictured above, the application of end-tidal CO2 capnography, and aspiration of gastric contents, which have all been found to be less than ideal to check for NG tube placement. Evidence suggests that NG placement should always be confirmed with X-ray visualization. This has been a presentation of Dr. Tom Badaev's series in Evidence-Based Practice. I look forward to your participation in the next topic in this series. Thank you for your participation, and as always, please hit the like button, share, and subscribe. Thank you.